So, can you kind of give us a state of the union of like where we are from a health perspective in America and why everybody cares so much about the MAHA movement?
I mean, it's sort of been this invisible threat. Since I graduated medical school, we've had this explosion of chronic disease that's completely unprecedented. When I graduated medical school, there was not a single state with an obesity rate over 15%. Now there's not one under 30, most over 40. The average is 42%. We're now 48th in life expectancy. We have horrible health metrics across every standard metric around health statistics like infant mortality, maternal mortality. It's pretty terrifying given that we spend twice as much as anybody else. We spend almost $5 trillion a year, which is $1 in $5 in our economy. It was up from $1.6 trillion in 2000. We're seeing rates of disease in kids go up dramatically, tripling. Type 2 diabetes wasn't even called type 2 diabetes when I went to medical school. It was called adult onset and juvenile diabetes. Now it's type 2 because kids get it. And we now have 1 in 4 teenagers with prediabetes. We have obesity rates tripling in kids. We have autoimmune disease increasing. We see 800% increase in ADHD and medication. We see, I think, an autism rate going from like 1 in 10,000 when I was born to 1 in 30-something kids now. And so we have this chronic disease epidemic where 93% of us are metabolically dysfunctional, meaning we have some degree of prediabetes or diabetes or some trajectory along there. And that's just a terrifying statistic, which means pretty much everybody in America is screwed. And it leads to all the things that we're suffering from autoimmune diseases to allergic disorders to autoimmune diseases. Did I say that twice? Don't worry, I just had surgery, so I was told that every hour you're under anesthesia, it takes a month for your brain to come back. So I still need a few more months. And we also see, rates of heart disease up, cancer going up. Even though deaths somewhat are going down because of better treatments, the rates are going up, the incidence is going up. And I think we have a crisis that has not been faced, as nobody's talked about, nobody's looked at. And to me, I've been talking about this for 30 years, so it's kind of this moment where all of a sudden the world's waking up to it, where it's in the discourse, in the political discourse. And I think we have this moment, like Callie and Del and Brigham were talking about.
Amazing. Yeah. One thing I forgot to mention, Mark's also the co-founder of Function Health, which is the fastest growing health tech company in the world right now. And essentially it's
the fastest growing company.
Is it?
It's the fastest growing in the A16Z's portfolio. Yeah.
Dude, okay. Fascinating. I just got the full pitch this past week and I was like even more excited about the investment than I originally was. But so what I've found is friends and family who I've been putting on Function Health, I'm like 10 out of 10 come back to me and they say how it's absolutely changed their life after one blood test. Some people have literally never tested their blood once in their life, other than just some standard procedure, and gotten functional reports back. Are you seeing that really affect a lot of change in a lot of your patients? And of the diseases that you stated, are most of those preventable/reversible with this functional approach?
Yeah, 100%. Most of the things that we're talking about that people are suffering from are both preventable and reversible. Even things like type 2 diabetes, heart failure, things that we don't think are autoimmune diseases, if you know what to do. And that's really the sort of operating system inside functional medicine, which is a new paradigm around systems biology, how the body's a network, and how to really deal with root causes. And that's what we have to do in America. We have to deal with the root causes of why we're sick. I wrote a book about it 5 years ago, came out in March 2020, not a great time to publish a book, called Food Fix, How to Save Our Health, Our Economy, Our Communities, and Our Planet one bite at a time, where I map out from field to fork how the food system, and by that I mean the food, ag, pharma, toxic triad, is driving chronic disease, as you heard earlier, is incentivized to do that and profit from it. And so the power right now for us is to actually map this out, think about it, and solve the problem. Sorry, what was the question?
It was, the last piece was like, are these treatments, are these reversible?
Yeah. So what we're seeing with Function is really quite amazing, is that we have now probably 150,000 members. We have literally millions and millions and millions and millions of data points. And we're seeing in our cohort, which is everybody across America, it's not just sort of the healthy elite, we're seeing 96% have lipids that look like they're metabolically dysfunctional. They have insulin resistance. We see 56% with ApoB high, which is a really kind of lethal cardiovascular risk factor that most people never test for. We're seeing 46% with high CRP inflammation levels, 33% with high ANA, which is an autoimmune marker. 33%, a third of the country has autoimmune stuff going on. That's insane. We have about I think 12% with thyroid antibodies that they're not checking, 67% with nutritional deficiencies. So we're seeing that this sort of what we're talking about with chronic disease, we're seeing it in our data.
Wow, fascinating. So, like, as a part of this kind of community we're putting together, one of the goals is obviously to like catalyze and inspire change, movement, action, building, investing. There's this commissioned report that's coming out, or is being worked on right now under this Trump executive order. Could you kind of explain to the crowd, if they're not too familiar with it, what that is and what that means and what you think the implications could be?
So on the day Bobby was sworn in as health secretary, he was in the Oval Office, and Trump announced an executive order to make America healthy again and created a commission, which Bobby's the chairman of, and Vince Haley, who's the domestic policy advisor for Trump, is the executive chair. And every secretary of every department that has anything to do with health, from education to Defense Department to ag and so forth, are all on this commission. And the mandate is within 100 days to create a report that documents the state of the state. And where are we with the children's health? Where are we with chronic disease? And what are the root causes? And so that's a very consequential report, even though many of these reports just get kind of done and swept under the rug. It's going to be something I think we're going to use to catalyze awareness and education, and we're going to go on a kind of blitzkrieg tour across the podcast landscape, across media, to really tell people what's happening in America. Why are our kids sick? Why are we sick? What's the cause? And it's not that complicated. It's the food, it's environmental toxins, and a bunch of other small things that I think are adding to it. And after that, there's another 80 days where there's a strategy document that has to be produced. It's like, what the hell are we going to do about it? And so that's really, what Callie was talking about is, Rome wasn't built in a day, and we have 12 years, and we have to take time to kind of figure out what are the winnable wins that we can move forward on that no one's going to push back against. And it's going to make the food industry and the farm industry and the ag industry look really bad if they're opposing something that's going to be protecting our kids. So that's what we're starting in on. And that commission report is going to be due probably sometime in June. And there's a lot of us giving input to it, and I think it's going to be a very important, consequential report that I think will sort of lay the landscape, that will give Bobby the sort of backdrop from a scientific perspective of what has to happen over the next years in terms of policy change.
And now that we know that food is the key driver to chronic disease, what are some of the three policy changes you think you would make right now that would make the biggest difference in regards to treating these?
Well, I think there's a number of things in each agency. I can just kind of pop some off, but I think the FDA is the key agency to regulate grass, which is generally recognized as safe ingredients that are not necessarily safe, whether it's trans fats or red dye or some of the additives and preservatives. To also change front of package food labeling, like they have in many other countries, where they have warning labels on the front that look like stop signs. If you're going to eat something that's not good for you, if you fly in a plane in South America and you get a snack, all of it has triple warnings, like don't eat this, basically. And if you drink a soda in South America that says on the can, don't feed this to your kids, it's going to poison them, basically. And it's like in the cigarette packs, they have the warning label. So that's a really important information transparency tool that. It's really about transparency. And there's a lot of pushback from industry about this. They don't want it. They don't like it. They hate it. And so I think that's a really important policy. I think there's also key policies within USDA that have to happen, not say under body purview, but we have to reform SNAP. It's the biggest food program. It's $125 billion a year, 10% soda, 75% junk food. And that's, causing incredible cost to the system through Medicaid and Medicare and all the consequential chronic disease that we pay for. So many of you don't know this, but the U.S. government funds 40% of the healthcare bill. That almost $5 trillion, about $2 trillion is paid for by the federal government in one program or another, whether it's WIC whether it's Children's Health Program or Indian Health Service or Medicaid and Medicare, and the DOD or federal health workers, all the health programs. And that is something that the government has tremendous leverage of. And it's $1 in $3 of our entire federal budget. So the deficit, and what I think Elon is doing, people are debating it. I think he's missing the forest with the trees. The big problem is that how we're spending on healthcare, and there's a lot of that could be trimmed by actually having a set of policies across the government that will fix this. Another important policy I think that could happen is reimbursement for food as medicine within Medicaid and Medicare. And we're doing a lot of these programs at the state level with Medicare waivers that the governors can do. So there's a lot of stuff happening in the state, and particularly in Texas. It's exciting to see. So I think reimbursing for food as medicine to treat chronic disease saves an enormous amount of money. The data is there. We just published a study, Cleveland Clinic, $12,000 savings per patient. If you gave them the food instead of the drugs. And the Congressional Budget Office, which is the government watchdog, basically believes that if you add something, it's an additive cost. So if you give them food, they're going to still need the drugs and the food. No, they're not going to need the drugs. I had a patient with heart failure, diabetes, She had multiple stents put in. She had kidneys failing, liver failing, high blood pressure. She was about to croak. She was on her way to a kidney and a heart transplant. In 3 days, she was off her insulin. In 3 months, she was off all her drugs. She was saving $20,000 a year in copay. I don't know what the Medicare was paying. It was probably $100,000. That all went away. It wasn't like additive. So we have to kind of help the policymakers and the people who are the watchdogs in Congress and overseeing it to kind of understand the ROI on this, because it's huge. And I think we had this moment where we can change some of these policies. I think also reimbursing for incentives for regenerative agriculture to transition farmers, because the problem is if you say, okay, we're going to get rid of soda and SNAP, what about the farmers who are producing the corn and all the corn syrup and all the food chain? It's like one thread you pull, it's going to connect everything. So you've got to think strategically about this. And I think for Bobby, the key is to start with the winnable wins, because if you start to sort of get rid of soda on SNAP day one, it's going to create a ripple effect that's going to hurt farmers and going to be problematic. But if you say we're going to close the grass loophole, we're going to label package labeling, we're going to reimburse for nutrition, we're going to make medical schools and academic centers who receive federal funding to actually mandate that they have nutrition in the curriculum for doctors, because nutrition is the biggest single killer today in America that's causing the chronic diseases that people are suffering from. I mean, Trump just pulled $400 million from Colombia for being anti-Semitic. Why don't we start pulling money from the academic institutions that are not actually providing the education that they should in medical school? My daughter's graduating in May, and she's like 0 on nutrition, 0 on insulin resistance, 0 on gut microbiome, 0 on toxins. These are the things that are killing people that nobody's talking about, and that has to change. So we can do that in the federal government. So I'm working with Bobby and the FDA and folks at the NIH start to change some of these policies, and it's really pretty exciting. So I never thought I'd be in this moment in my life. I'm like 65, it's just like in a startup and about to, like work on all this shit. But I could be, riding my bike in Maui, but here I am.
Thank you. So it was rumored that you were maybe going to take a role in the HHS. Was that true or is that false?
No.
At one point, were you ever considered?
I don't really need another job.
I figured you didn't. I think,
but I will serve, just as an informal advisor. And if Bobby asks me to be on a commission or nutrition advisory group or whatever, I'll help Bobby.
Cool. Are you seeing in and out of DC? Are you seeing any topics that are actually getting bipartisan support? I mean, I feel like so much of this MAHA movement has been suffocated by the fact that people just aren't seeing eye to eye on many other things. So
I mean, it's interesting. Brown, my wife, who you were thankfully applauding, who's amazing, way smarter than I am. She's all the power behind me and the brains. Wait, ask me the question again. I'm sorry. I'm having anesthesia brain.
I was asking if there's anything. If there's anything that you're seeing that's actually getting bipartisan support. People are actually
what was really interesting, she showed me this little graph where it was like this vote on something, and it was like completely one side of Republican, completely Democratic the other way. So there was like nobody voting against anything that their party was sort of aligned with. But I do know from spending the last 5 years in Washington with my nonprofit, the Food Fix campaign, which we're happy to take donations for, by the way, because now is the time to kind of ramp up to get movement going. We found that there are so many Democrats and Republicans who are aligned with what we're doing, whether it's the Senator Boozman from Arkansas or Senator Booker from New Jersey. There's tremendous bipartisan support, both from congressmen and congresswomen and senators on both sides of the aisle. Now, they may not publicly say this. And, Cory Booker literally called me the day after the election and said, can you connect me with Bobby right away? And it was like, he wants to be in the conversation. Now, he didn't vote for him because he can't, but he ideologically is aligned. And I think that kind of stuff is starting to really happen. I mean, Roger Marshall, who I wrote about in my book, who was a congressman at the time, was at a hearing that was about obesity, and they were testifying about how food was a contributor. And he's an OBGYN. He said, no, it's all exercise. And I called him out in the book for being funded by the American Confectioners Association and Corn Refiners Association. And now we're friends. And he said, I'm reading your book. I said, just be careful. I call you out in the book. He said, don't worry, I've been called worse. But now we've got people like that, who's the head of the MAHA caucus in the Senate. We've got Vern Buchanan, who's a Republican I work with closely. We had a hearing in September on many, many bills related to medically tailored meals, Medicare. He's in charge of Medicare. He really says, Mark, whatever you want. Like, I'm the guy in Congress who's overseeing the $1+ trillion in Medicare. Let's go. And so we're doing all sorts of incredible things. So we just passed a bill the other day about obesity in the military, which is insane. We see now 70% of recruits, 77% of recruits get rejected because of obesity or health issues, and there were 72% more evacuations from Iraq and Iran. Iraq and Afghanistan from obesity-related injuries than from military injuries, which is staggering. This is from the Admiral in General's report called Mission Readiness. So we have a crisis, and there's a lot of things on both sides of the aisle that we can come together. I just don't think you're going to see it in the press. I don't think you're going to see Democrats coming out in support of this. But I think behind the scenes, there's going to be a lot of stuff going on.
Are you optimistic about the next 4 years?
It's like one of those moments where it's full of possibility and fraught with danger. So it could go either way. And right now, I think Dell's right. We have to mobilize. We have to create a voice in the country to activate people around this wherever they are. I think Cassidy said he got more calls about Bobby Kennedy's confirmation than anything else. There were like 200,000 phone calls to his office to confirm him for HHS secretary. So that's the kind of thing we need to pull. And I was talking to Dell about a big idea for the summer about how to get Bobby out on the road and do a kind of a tour to really activate the people in this country around this issue. Because people think, there's an election that goes on and then they go back to sleep. So we have to keep this moving, and I think it'll be okay. I think there's going to be pushback. I know for a fact, and I wrote about a lot in my book, how the food industry, it is so systematic. Food farmers so systematic about how they corrupt and co-opt our system. And can I just take 1 second to unpack that?
Yeah, come on.
So first, they obviously do more lobbying than any other group between the ag and the food industry. Second, they fund 12 times as much nutrition research as the philanthropy or federal government. So American Beverage Association finds that Coca-Cola doesn't cause obesity. Oh, surprise. They fund academic institutions and research organizations. They fund all the professional associations. The American Heart Association gets $192 million a year from the food and farming industry. It's obscene what they're saying. And so does the American Academy of Pediatrics, the American Academy of Family Practice, the American Academy of Pediatrics. Pretty much all those professional associations that are supposed to be giving us advice are co-opted. And then you've got front groups like the American Council on Science and Health, which sounds like a great group, but a lot of those guys are criminals and Medicare fraud guys who are saying that pesticides, tobacco, high fructose corn, trans fats, and all that is fine for us. And they come out with all these hit pieces on people like me. And you could just Google the American Council of Science and Health and Hyman, you'll see all the hit pieces on me. And they'll do it on pretty much anybody who's talking against them. Also, they co-opt social groups like the NAACP and Hispanic Federation. So I was in a movie Fed Up a few years ago, about 10 years ago, and I met Bernice King, who's Martin Luther King's daughter, in Atlanta. I said, this would be important to show this movie about childhood obesity in the King Center. She says, great, let's do it. And a few days later, I get a call from her. I said, we can't do it. Why? Coca-Cola funds the King Center. Spelman College, funded by Coca-Cola, like half the admitted class of women at Spelman College, which is an African-American college in Atlanta, for women, half of the class is obese or diabetic or has a chronic disease or hypertensive, and there's Coca-Cola machines all over the campus. And I asked the dean why, and she said, because we get all this funding from Coca-Cola. So that's the level at which they're infiltrating every single aspect of what's going on across every sector you can imagine, and they're organized, and they have a war plan, and I know about it from the inside. So I have spies, and I tell you, it's coming hard, and they are going to fight against this. I mean, the First Lady of West Virginia was one of my key people in Washington, been working with me, who just became the First Lady. She lost 112 pounds just by working with me, no Ozempic. And her husband's now the governor. They just passed a bill to get rid of dyes and chemicals in the food. And all the food industry is freaking out, running in the governor's office, telling them it's going to destroy their businesses, hurt the economy, do all these terrible things. And I'm like, they have till 2028 to do it, 2025 to do this. 28. Sorry, my brain is like whatever. They have till 3 years to do this, and they have the capacity. They know how to do it. They do it in other countries that don't allow this shit. It's just a big con game, and the people who are the politicians don't know better. And so they hear, oh, it's going to hurt the economy. It's going to hurt my population. It's going to hurt everybody. Don't do it. So it's just, we have to constantly fight back against this. And I think it's David and Goliath, and I think David's going to win.
Agreed, man. Agreed. Absolutely. Well, this is an inspiration. Thank you very much, man. Not only the founder of the fastest growing tech company in the world, one of the best dressed 65-year-old men I know. So,
No, very good.